Hello, everybody in various parts of the EU and other places. Anyway, in the previous webinars, you should have heard about all the benefits in the use of PCT, person-centered technology. My name is Steve Barnard. I'm retired, or retired doing a bit of private work, but I was in social care for over 40 years, mainly with people with a learning and physical disability, although I have worked with people with mental health problems and the elderly. When you think about ethics in the use of person-centered technology, it's not just about technology, it's about the delivery of care, what we mean by that. Just to start, this webinar will be recorded, and I hope that's okay to everybody. Your microphone and your video are muted and blanked out so that we get maximum reception. And if you've got any questions, please go onto the chat room or ask your questions at the end. That way we want everybody to get the right amount of time. If you need captioning to hear what's being said, please click on the live transcript button. There's a thing called captioning, and anyway, you can then see what's being said. Just in case I forget, I would like to thank the other presenters, Yusra, Emmanuel and Sharon, before we start. And of course, Dimitri from ESPD, who's still eating his lunch at the moment while we speak. And of course, ESPD and yourselves for watching. So when we talk about ethics, we talk about good and evil, right and wrong, virtue and vice. And of course, this can vary between cultures. It's actually why we do what we want to do, and it does vary. There isn't just one answer to this. So why do we do what we want to do? And there's some questions I would like you to ask yourselves. Should people with disabilities be grateful for your support? We do expect people to always say thank you. Do people have disability to pay for your lifestyle? When I started, which is over 40 years ago, this was not a career. And there were some jobs that didn't exist then that exist now. People now pay mortgages from their salaries when they're working with people with disabilities. So if anything threatens them, they have a problem with their lifestyle. Is having a disability a life sentence? So when you get a disability acquired or you're born with a disability, do you have to be locked up with people you don't like and be supported by people you don't like or didn't choose? These are just questions. They're a bit hard, but it is right. These aren't easy problems. And also remember that if we live long enough, we'll probably all experience some of these problems around mobility and communication and personal care. As I said, in society, it does vary what regarded as the right thing to do. Catholicism says one thing, Church of England says, Protestants say something else, and there are all, there's categories of those religions and other religions that mean you have different things. The history, how did you get to where you are now as a culture? And as we say culture, are we used to having people with disabilities living in certain environments? Are we just them being in the streets? How do we actually view those? And to give you an example, in England, we have a history of philanthropy. We care for people with disabilities, and they have to be grateful. So years later, when we don't have such a culture, we still have a legacy that says we should look after people. And if we do look after people, that means we're good people. If you go to Scotland, people with disabilities, physical disabilities, have been touched by angels. That's what they believe. As we know, angels are very high in terms of status. However, they mustn't have physical relationships. And that has a real impact in Scotland, where I have worked. You will hear about some of the psychological barriers, organisational barriers, and some other ones later on in the presentations. And remember there might well be barriers that you can identify that are not true in other places. They might just exist where you are. I have done a lot of work on barriers, and I've come down to believe that there are two extremes. One is about the medical model of disability. The problem with that is that's where all the money comes from, the structure. It's how you get money. And the way you get accepted by the powers that be is they ask you what you can't do, and they ask you what your diagnosis is. And that's like the entry ticket to get money and to get structure. On the other hand, we have the social model of disability that talks about rights. I want my right to do this. I want a right to do that. However, even if you're in a wheelchair, you might well work and you might well earn a salary. Do you still need some of the other benefits that you're allowed to get because of your situation? And we have a very, very clear clash between the two cultures. You will all have heard about various technology, and if you were at the conference, you'll have seen things like telecare, telehealth, ICT apps, their latest thing, virtual reality, artificial intelligence, not artificial technology as my screen says, and of course growing is the Internet of Things, all dependent on connections. We don't talk so much about ICT and computers anymore, yet that's as true as anything. We also have data and accessibility. And this is a new area for us about data security and the ethics about knowing that someone knows all about you. And accessibility has always been a problem. Do you build in accessibility, or do you then add it on later with all the problems that that can entail? And remember, when we talk about disability, we are talking about ranges of disability, from physical disability, aging, learning disability, mental health, and so on. And of course, most people have more than one. But when we talk about the technology and PCT and all that stuff, that to me is not half as important as about the outcomes that we expect people to achieve. Now, the outcomes can be identified in the assessment. Most people will have some assessment of what they want to do. Is it about independence, control, communication, education, leisure and arts, health, mobility? And it might be more than one. Now, because someone wants to achieve something doesn't mean they can, but you know the path that they want to be on. Technology comes along and it might enable people to achieve that. I've also added on safety, because people think they shouldn't say about safety. We all want to be safe and we all enjoy being safe. And that's no different for people with disabilities. But it's not safety in my own mind, it's not safety at the expense of the other outcomes. Now, this is what I came up with as the outcome of the ethics. Independence, control, I've changed the word, beneficial, no harm, justice. It comes out of a philosophy that was created, I think, in 95 by Beauchamp and someone called Childress, or 94, sorry. Now, that was before technology, but it's still important. Where does the technological enabler fit in to these particular technology? I also started using Maslow's hierarchy of needs, which I thought I'd buried and put to bed. But it came again, and people were thinking I was talking about self-actualization, esteem needs and all that. In fact, we were talking about technology answering some of the physiological needs, some of the personal needs, some of the communication needs, some of the reminders. Now, if you start seeing or linking up the technology with a particular outcome or the needs, it actually can be a lot easier to get some of the structure to respond to your demands. When I'm using, or when I was using technology more, I asked some questions. What outcome is being addressed? And as I say, you get that from the assessment. Who is the technology for? It might well be for parents or carers. There's nothing wrong with that as long as you're clear that that's who is benefiting from that. The individual might not. The parents or carers might be concerned. So for them to be able to see and communicate with their son or sibling, daughter, is actually for them, not for the individual. What is your policy on consent? What happens if someone says, I don't want to use that technology? Are they allowed to say that? They should be, but that's my view. Your view might be that you don't have a policy on that, but the rights movement does say more and more you should be able to consent or not. Who is supporting the technology? When I started, a lot of care staff put the technology in the cupboard out of that if it stopped working. They didn't ring anybody. There was no help. There was no support for batteries or it had just broken down. And do you have protocols? So when the technology works, what happens? What happens when it doesn't work? And by that, I mean, if there's a sensor, who's going to test it? And when the sensor is activated by someone opening and shutting the door, for instance, what happens? And how do you know you're going to be able to respond to someone if it doesn't work? Do you have contingencies in place? That's me just about finished. But remember, technology is nothing magical. It's just another enabler. In my mind, staff do not have or shouldn't have a right to say we will or won't use the technology. It's how you use it. It's giving them the support and the competence to use it. So that's the end of my presentation. As I say, this is recorded, so if you want to get the details, they're there. I'm now going to stop. I'm asking people to introduce themselves because I think it's easier. And so I'm now moving on to user, and I will stop sharing my screen. Thanks very much indeed.
Thank you very much, Steve. And thanks everyone for being here. Thank you to the ASPD for the invitation. I'm very happy to be here. My name is Yusra Sandabad. I'm a project officer at Centre de la Gabrielle. I'm in charge of European project, but also, and that's why I'm here today, in charge of the development of a project that is called La Clé Digitale. I will tell you more about it. Maybe first some few words about Centre de la Gabrielle. We are a platform of services based 30 kilometers away from Paris. We offer support to people with disabilities, over 500 people, children, teenagers, adults. And lately, we have been focusing a lot on, I mean, for obvious reason, and also because, I mean, that we consider this as an essential thematic, digital inclusion. So we developed a project that is called La Clé Digitale. I would like to present you a bit what we do, and in order to talk about what I've been asked to discuss today, which is psychological barriers. So La Clé Digitale is a third place of digital inclusion. The place has been conceived in the spirit of the institutional. Always have trouble with this word, deinstitutionalization. Okay, so the idea is to implement a place that have been thought first for the needs of people with disabilities in the city center for one simple reason. Digital needs are not only needs that are specific to people with disabilities. Of course, I mean, everyone is considered, everyone has digital needs, and everyone needs support to different extents, right? But even a person absolutely comfortable with the computer, I mean, working with it on a daily life, will always have something to learn every day. So how do we work? We have a convention with the city that enables us to open up to the general population. And we work, for instance, with seniors who have similar needs in terms of digital tools. And we have a very, what I like to call a knock-knock modus operandi, because people come here as they will go to the doctor, and they will say, knock knock, hey, I would like to learn how to use my computer. Hey, I would like to, I don't know, send an email. Oh, by the way, what is YouTube? And just practical questions. We do not offer magistral courses. We want people to go out and to come back home with a specific tool. So we identify the needs, we recommend solutions, and we try to do some follow-up depending if the person wants to come back. Why am I describing you all of this? Well, for one simple reason is that I find it very troubling to talk about psychological barriers for people with disabilities as a whole. There is no such thing as global psychological barriers to everyone, because everyone has specific needs, right? So having a disability doesn't mean that you will have psychological barriers in the use of technology. Just to be clear, when I'm talking about technology, I'm referring to what we do experience here in La Clé Digitale, which is daily life technology, computer, smartphone applications, so things that you will use really in your daily life. So we can have we can have a person with disability that will help a person without disability overcome psychological barriers. I mean, that's my main point. There is no such thing as global psychological barriers for people with disability, because there are different ranges of disabilities. There are different needs that are specific to everyone. So so that's the idea that I wanted to share with you. Maybe if we even take the reflection to another level, the psychological barrier sometimes can be the overuse of the technology. We have lots of people who can come here and who are way too comfortable with technologies and who have, for instance, addictions with gaming, with gambling applications, so we have to be very careful when we speak about psychological barriers and really offer a specific answer to everyone. So I would even like maybe, but I think, Steve, please tell me if I'm wrong, that we're going to be discussing this later, but beyond the barriers, focus maybe on opportunities, always based on the experience that we have here, on how to overcome potential and, again, individual psychological barriers. So yes, I'm just saying it here quickly, but I think we will be able to develop this further later. But it's one solution, one dynamic that is quite present here in La Clé Digitale, simply peer counseling, that helps lots of people to go beyond fears, beyond anxiety, beyond troubles that they can find in the use of technologies. So that's my point. I will be really happy. It's very succinct. I don't know how you say in English. It's very direct, but it's for one simple reason. I would like to know what you think of it, and maybe we can discuss this later in the Q&A session. Thank you, everyone, and we'll give back the fictional mic to Steve.
Hi, folks. I think we're going to Emmanuel now.
You need to unmute, Emmanuel.
Yes. Okay, I'm sharing my slides. Okay, there are barriers related to this technology adoption. And in ESPD, that's a group of service provider. They provide service based on this technology. And the way these service provider are organized will also create barriers. We've seen with Steve that there are ethical problems, with Yusra there are some psychological problems. And I'd like to show you that the way they're organized will create also organizational barriers, and how in the future we'll be able to get rid of these organizational barriers. So here I'm really talking about the way we're designing, organizing, and delivering services based on technology to improve the life of people with disabilities. What we need to take into account first is the notion of a customer journey map or a user journey map. For instance, here you've got a family. In the family, there's a person in wheelchair, and they book a trip. They organize all the luggage and prepare the trip. Then they take the train, then a shuttle, then they arrive to the hotel, and then at the reception, they got the key and they can start their vacation, okay? So the problem we've got with service provider that base their services on technology is that they're very much focused on their own, what we call touch point, their direct interaction with the user. For instance, if you take the train here, it's a touch point, and in advance, thanks to an app, you can tell I'm in wheelchair, so you get an help. You'll get some, you'll be able to use equipment provided by the train company, and then you can do that part from your city to the destination. The problem we've got today, that's the fluidity between the start of your trip till the end. And that's where basically, because we're organized in touch points, so very focused on the delivery of a single service that is optimized, we forget that in between each these steps, there are problems, okay? And that's a big problem. And that's where what I want to raise is that the way we organize today in the service sector makes that very often the customer journey is not fluid, is not optimized for the user. We talk often about the first mile, last mile, okay? And what we would like is that all these service providers that are doing a good job at each step of the customer journey, they work like an orchestra. They work together. So, as I said, that's a big problem we've got among our service providers, is that notion of uniqueness of objectives. Here you've got three different definitions of what is an organization, a service organization, and each time you see about that notion of achievement of the objectives. It makes that they're so focused on that they forget about the entire customer journey of our users with disabilities. So it's about design and designing things upfront, upstream. I like this photo. Do you see? The architects, they're able to design beautiful environment here, like a garden. And what happens, it's far more practical to go this way, okay? And it's really important that right from the start, it's well designed in order to address properly that customer journey. Otherwise, you'll have flaws, and the consistency of the service is then not good. So the good thing is that in the past, the service provided were what we call supported services. You've got a need, I will address it. And now there's a change in the design of the services. We're going towards enabling services. The logic of that is that we're doing the service with the user. And you've got that motto in Europe, not on us, without us. So that's the evolution of the design of services. And thanks to that, will get rid of these organizational barriers that are very linked to the way we're producing services today, meaning very focused on our single touch point, on a single touch point. Okay, just to show you how difficult it is to design a service, it's an engineering map of a service that will be provided to user. You see it's very standardized, very rigid. Okay, so in the future, what will happen is that you'll deliver your own service, but you'll take care of what happens before your service and after your service, okay? To optimize your own service, but also to optimize the passage from the previous service to the next service to get a more fluid customer journey for the user with disability. Never forget, we say that a service acquires value when the client perceives its benefits, okay? And every user, every client has a high level of expectations. And the goal of all that is that people with disabilities, people without disabilities, together, they can experience life activities and reach very high level of satisfactions. Okay, so this is the end of my talk, and thank you very much for listening.
I
So
think
Steve,
we're now
back to you.
We're now going to Sharon.
Thank you, Steve. I'm going to share my presentation. Okay, so just to introduce myself, I'm Sharon Borch-Cambry and I work in Agencia Support in Malta, and I work in a section in a service within Agencia Support, which is the what we call ACTU, Access to Communication Technology Unit, and actually work with persons with complex communication difficulties as well as complex physical disabilities, and we assess in order to find technologies that can help them either be able to communicate and express themselves, or even to access education as well as their environment. So obviously throughout my experience as well within the service, we does encounter a number of barriers. And obviously this is not also something that we only experience, but even when you look around, when you discuss with other services, and also when you look into the literature, you could see that this barriers, especially where it is towards person-centered technology, it's experienced especially in Europe, and it is reducing the opportunities for persons with disability. We can say, however, that digitalization has increased participation and actually increased our participation in the public sphere, in our social and cultural sphere, as well as in our economic and political sphere. And it did open opportunities as well for persons with disability to continue to participate, voice their views, and also be part of their community. So like the barriers that we need to look into, and then we can also discuss further, and that we need to change, and we look what these are barriers and how we can also try to overcome them. We are looking at barriers at the societal level, and barriers at the community level, as well as barriers at the personal level. So if we look into societal barriers, I think
the first thing that we really feel is the lack of enforcement of EU laws and regulations. We can see there's a lot of laws around, and now also it is good that we are seeing as well the strategy on the rights of persons with disability, the 2021-2030, which is aiming to issue a number of initiatives and to be able to address some of these barriers. And I know that even who was present in the conference, the EU Commissioner Katrina Ivankovich has also talked about her work that she would like to continue to work in order to be able now to have these EU laws to be implemented at the national level, because I think that is the most difficult, that we are seeing that different countries are not at the same level, and they might implement certain parts of the laws, but other countries are still working towards implementing these laws. And obviously, this will affect persons with disability in different countries. We also the real commitment to provide ICT and AT, also that this is accessible and available to all persons. And I'm saying all persons because, as Stephen said, like in our life, we are using digitalization, and also throughout our life, we might experience some difficulties and some disabilities. We can see this as we grow old as well, and so both us as persons with persons living in the community, as well as persons with disability, we need to have access to this technology that can help us to participate in our community. Also, availability, that it's also a problem from lack of funds, and also human resources that in terms of professionals that are available that can help persons with disability to find the technology that meets their needs. Then at community level, we still see poor knowledge of ICT and assistive technology, and also poor digital competencies. We have either the services are not available, or maybe not accessible for all the persons within that country, because either they might be living into areas, maybe areas that they don't have services, etc. Also, poor availability of accessible technology in the workplace. Also, we are maybe also students might not always have the opportunity to access and learn digital skills. And either because they don't have the technology available, they don't have the access methods that are ideal for them, so that will be able to learn these digital skills. And then because of this, we are seeing also difficulties when it comes to employment, because digital skills, it is something that it is at the moment, it is required in order to be able to be, it's one of the employability skills practically. And something else is we are also having another barrier from fragmented service delivery systems and lack of interagency collaboration. And here we need to emphasize the importance of collaboration between different entities, different ministries, different services, because in that way we can use our resources together and efficiently in order to be able to make accessibility of ICT and AT for everybody. Then at the personal level, and I think here also Yusra has mentioned, we have the fear and anxiety towards the use of technology and use of internet. Some might be cautious about maybe because their data is going to be like now in the public, and so they are afraid that they might do something wrong, etc. So obviously this would require education and also teaching about security, internet security, etc. Also, lack of user and family training on how to use ICT, AT, and also, as I said before, poor digital skills. So just to finish, these are some maybe recommendations, and now we can also discuss a bit more, but I think it's like the increased commitment amongst EU member states, countries to implement existing laws, allocation of government funds or other funds for AT provision and human resources, training programs to improve digital skills of persons with disabilities, as well of the elderly population. I can see whenever we have elder people who refer to us, sometimes they are they have lack of digital skills, and so they are afraid to try the technology as well. And also us as service providers, we need to understand the impact of technology on our service users, participation, the community. So we need to services to make sure that they are knowledgeable about digital skills, that the staff is develop their own digital skills. Also, we try to reduce the digital divide as much as possible, and for colleges and schools, they to put digital skills at the top of their list. Thank you. So I think now, Stephen.
Right, I hope everybody can hear me, but I thank all the speakers for their input. And as I said, there are no simple answers, but we now have about 20 minutes or so to talk about how we identify the barriers and also how we should overcome them, because it isn't just accepting they're there, it's about overcoming them, moving forward. Looking through, I can't see any questions at the moment. Hello, Jan. But does anybody have any questions now? If they want to put their hands up or speak. Remember, we're talking about you and your service. I can see a hand up. It's gone. That was useful. Is anybody, Dimitri? I can't. Yes. Is anybody put their hands up to you?
No, there are no questions for the moment.
Well, can I then ask, I mean, Yusra, you talked about really technology for everybody. Mm-hmm. We all use technology. We're all expected to use technology. How do you see that going forward? How would you overcome the barrier that especially older people or quite a lot of other people do not have access or don't know what the words mean? I will swipe the screen. What does that mean? I will use my mouse. They run across the floor and frighten people.
Well, I mean, if I understand well, your question is how do I see in the users that come to La Clé Digitale that it's a need for, I mean, it's a central need for everyone? Or sorry, I'm not sure I understood the question.
Well, the question is how do we, I suppose, widen out technology so that people don't feel frightened to use it or frightened to say, I don't know how to use it, so I'll just not use it?
Well, first, in terms of support as service providers, we have to be very comprehensive of the gap that can be between, I don't know, a young person that will receive that person and that will be using the technology in his everyday life, and we have that person in front who never touched a laptop, who never touched a smartphone. We have these cases in La Clé Digitale. So first, we have to be aware and understand why people can fear the tool, right? And we have to show some understanding. That's the very first step. After that, I think beyond the support, that person we have to help that person change perspective, and reassure that person in the sense that, okay, it's not, lots of the remarks that we have is that I'm afraid that if I click here, well, something is going to happen, Yeah. Something is going to happen. And then you have to help that person deconstruct that the worst case scenarios, what is not going to happen. As Sharon said also in her presentation, really just training, you know. So beyond this classic method of just training tools and I mean support, what we see here in La Clé Digitale is that people who come for the first time and who manifest fear, anxiety regarding technologies, and then come back and see their peers also going through the same struggles. And when I say peers, I'm not talking only seniors, people with disabilities and people with disabilities. I'm talking about peers as a community of people who leave the digital gap, right? So what we can see, what we observe is that when people get used little by little to the tools, they intuitively start helping their peers, and that's way more efficient than when a young person is going to come and go fast or as comprehensive as that person will be.
But that requires people to be less arrogant and conceited, but I can do it, you can't.
Naturally,
and encouraging people to feel that they want to share their skills. If I can ask Emmanuel about the customer, you talked about a customer journey, which I thought was really interesting. Who is the customer?
The customer is the client. But what's interesting also is that when you define the client of a service, it's also the co-producer. So we're all clients and we're all service producer. That's what's interesting today. And I like very much what Yusra said about training, okay? It's beautiful technology, but it's very complex technology. And we need to train to stage that new life experience with plenty of advantages, but we need to train it in a holistic manner. And we need to take into account first ethical aspects, psychological aspects, as presented by Sharon, all the regulation, all the society issues. And if we do not work together, okay, we won't be able to adopt to make these beautiful technologies useful for people. What's also interesting is that we're talking about universal design or inclusive approaches, is that what's beautiful in our community is that we've got all the ingredients to stage that in a holistic manner. And we know that it will serve the purpose of everybody because we're all aging. So here, in terms of innovation, we've got an edge we need to use.
But Emmanuel, you talked about the complexity of some of the technology. How much should people need to understand about that?
In fact, they should not be concerned with that complexity. But if you do not train that, if the service provider just concentrate on, I've got an app that does that, and do not help all the different stakeholders, as I told you, we're all clients, we're all producers, we won't get like in an orchestra something that that is playing in harmony. Okay, so that's my point on that, is that yes, it's complex. No, the user shouldn't be concerned by that complexity. But if at the level of the service provider we do not work hand in hand and directly with the user, there's no way that that technology will be accepted. Because when you get it for the first time, it's brutal, it's complex. It's difficult to get that adoption. It doesn't come naturally.
Okay, Sharon, you specifically mentioned training, which hadn't it been implied before, but not mentioned. And you talked about the laws, policy commitments, all of that, the funding, the structure is not there. to absorb technology and use it. Interestingly, there's a social work magazine in England, and it had an article many years ago about why social workers were the last people to use computers. And the answer was because they're so used to guessing, and why should they learn anything because they can guess it. But you talked about here's a structure and everything is against absorbing a new skill. So how would you, in your service provision, say that we must do this? How would you enable it to happen?
It's not that easy, because like even from our side, like sometimes we offer training, we'll try, and I think it's and it is about I think listening from the actually users, see where is they having difficulties, and try to design that. Even the training has to be designed for them, because like we'll do a lot of training, but whenever I go and work with the people, I always say, understand that maybe something that's for me, it's easy. Like even like when using technology, sometimes for me, it just comes easy. And like I say, okay, what is the concern, or what is it, the problem with this? Like how can't they use it? But then when you see their viewpoint, you see that there is a lot of lack of understanding or lack of knowledge, that together all of this, they can't actually use this technology. And sometimes there is technology that you can just start and use it, but there is other technology, like for example in our case, like even the use of communication devices. Like it looks that is easy, yeah, just for certain people who might not have difficulties with communication, with social communication, they might get the device and start using it. But when you are working with persons who have also social communication difficulties, and maybe they start developing their language, it is not about the technology only, but it is about strategies that you need to implement, but also you need to teach other people how to implement those. So it is quite complex, and I think like this is something that we discuss every day, because you give training, and still you feel that it's not enough. So I think even like if there are other people who would like to share about this, it would be interesting. So at this point in time, I think the best thing is to even listen to the user, and the user, not also the person with disability, but also their carers, their educators, and see how we can design training for them, so that it's easier for them to use the technology, even with the users.
Sorry, Sharon, is that training for the staff or for the people with disabilities?
And it's for every, like we need training for the staff and training for persons with disability as well, and training for the family.
I just saw a question from May. This is really for all of you. How user-friendly are these technologies? That's a question. How have you found them? Are they user-friendly or are they complicated?
I guess it really depends on the technology that we're talking about, and on the perspective that the person, as Sharon says, that has on the technology. But I guess that if for one technology we see that it generates so much frustration, so much, I guess it is not so much friendly, right? I just have this example of a lady that came to L'Acte Digital yesterday, and that was presenting a tool that they developed. And I really found I mean, the idea is it's an application where for people that are in a situation of precarity, that need support, not people with disability specifically, but more generally people who need a place I don't know, where to eat, where to wash, where to get training, just basic services. And the application is extremely simple. You just log in and there are icons with what you are looking for and the place where you want to find it, right? So this, as simple as it is simple for me, you know, from my eyes, because for me, but again, there are so many different perspectives that for me it's quite, I don't feel entitled to answer this question on how a technology is friendly or not.
No, I think what is interesting in what you said, and I'd like the others to comment, is because it might be simple to you, it might be complicated to someone else. So the experience is very individual.
Exactly.
Emmanuel, you were nodding.
Yeah, and just to add on that, to play the devil's advocate, you've got wonderful engineers, and often they forget to ask the users. And for them, it's really simple to use. And so we need, little by little, we need to acknowledge that these engineers are doing a great work, but to help those users to get a better acceptance, they should involve more in the future the users.
I think it's about your co-design, isn't it?
Yeah, exactly.
Sharon, you wanted to say something.
Yeah, just even adding on what Emmanuel is saying, like I think it's also like having technology which allows for customization, which is you can customize it for that particular individual, so that to meet. And here I think it's like the technology, is it complicated, is it easy? I think it goes back to the assessment. It's like trying to find together with the client which is the best technology for him, that is easy for them, that they can understand as well. And obviously having technology that you can kind of like customize, you can make it easier for them, and that is obviously that allows you to use certain technology, and maybe that technology can be used with different people as well. So
yeah, I think in that I do remember in one organization they said we will send the engineers out to do an assessment. What they meant was the assessment was what's your power supply, where are the plug sockets, and so on. And we said, no, it's about people's homes. You need to understand you're going to someone's home. They then say, we're providing, say, an aneurysis sensor, which is something they said if you wet the bed, if you urinate on the bed. It's also true if you perspire too much. It's also true if you pour water on the bed. So understanding what the technology actually does, what activates it, is quite important. But as Emmanuel says, that's not about being, everybody's got to be a skilled engineer. It's about letting engineers know they're serving us. We're not serving them.
Yeah, exactly.
If that helps. Does anybody else want to? Oh, Emmett Yan, if you're listening still, are you still there? I can hear nothing now. Because Emmett Yan is chair of a person-centered forum group for the ESPD, and I was wondering if he wanted to encourage anybody to join. But if he's gone, then that's no. Oh yes, I am. Can you speak, Emmett Yan, and get and tell us about your group? Dimitri, can you unmute Emmett Yan? Well, I'm shown as Dimitri there, but
Okay.
Hey, there you go.
Yeah, there we go. Thank you, Dimitri. Hi, everybody. You know, I've been listening. It's been extremely interesting, and congratulations to you, Steve, for moderating so well, and to everybody for what they said. No, it seems to me that the main challenge is to make sure that people that might benefit from assistive technology or other forms of technology that help them to overcome difficulties are actually in the position to get access to that best and most optimal technology for them. And that is quite a challenging process. I was listening to Emmanuel, and I wrote it also in the chat. What I really like is this I mean, we all know how fragmented services are, but I think the metaphor of the journey was very illustrative and very clear. We in our service here, we try to advise and to assess people to help them to make the right choice when it comes to technology adoption. And that's a very complex process because it involves training, it involves taking into account environmental factors, it involves taking into account personal factors, barriers at personal, community and societal level, if there's funding, etc., etc. So, and that is very often not seen by those that pay for our services, the public health system, which is basically made up of doctors. They will just say, okay, we want you're a specialized center in this, so you should just this piece, and don't bother about whether it fits in the environment, whether the teachers can work with it or whatever. You just do the matching between the person's abilities and the technology. And that is a problem, and it's an everyday struggle to get that message across, that we really need to work on all those conditions that are favorable and making sure that the whole process goes well. And that involves also personalization, training, providing training, both to the professionals as well as to the person, the end user itself. And yeah, so yeah, that's basically what we do here.
Jan, could you just say very quickly, we're almost at the
About
end,
the PCT, yeah.
about the PCT group.
Yeah, sorry for that. Okay, so within ESPD, we have a person-centered technology membership forum. And I'm one of the co-chairs together with May, who's also present in the call. And basically, it is a group made up of members of ESPD that have a specific interest in person-centered technology. We organize webinars like the one of today. We have organized a conference in Brussels 2 months ago, which was very successful in terms of audience, and also I think content was good. And we support other organizations within ESPD or other members of ESPD to get a better idea about what technology can do for their service users. And we support the policy development of ESPD around this topic about the digitalization in the social care and support services. So yeah, whenever you want to join, that's quite easy. You can just drop an email to Omar or to myself or to May, one of the co-chairs. If you're not an ESPD member yet, then it's a little bit more difficult, but you can always consider becoming an ESPD member and then join the Person-Centered Technology Membership Forum.
It's not getting paid by ESPD at the moment, by the way, folks. Thank you, Jan. Anyway, we've come just about to the end of this webinar. I would like to again thank my co-presenters. And remember, folks, it really is up to you all to find a way to embrace technology. Don't be frightened, we all are. So thanks to Dimitri, thanks to ESPD, and thanks to all. Cheers, folks.
Thanks to you, Steve.
Thank
Bye
you.
all.
Thank you. Bye.
Bye-bye. Cheers.